PSA testing and testosterone replacement therapy. Let's talk about the literature and what it says. First and foremost, let's talk about what PSA is, okay? So PSA is an acronym for prostate specific antigen. And to put it simply, PSA is actually it's an enzyme secreted from the prostate, and what it does is it makes semen less viscous. So it breaks it down, makes it less viscous because semen before PSA interacts with it has more of a like a gel-like quality, and it makes it less viscous. And by doing so, it makes it more permeable for the semen to penetrate into the cervix, and therefore makes it easier to get your partner pregnant. What's interesting about PSA production is that as you get older, PSA production continues to increase as you get age. That's a natural anticipated finding is that it will continue to increase. So it's speculated that's kind of an evolutionary thing in the sense that even as you get older, you're still quote unquote, you're a fit, you're a healthy, you're a competitive, fertile male. Hence why you keep producing it because it wants to help biology. It wants to help in the act of procreation. That's why you'll keep making more because you want to keep producing healthy sperm that can penetrate the cervix. Another interesting thing about the PSA is that if you do have prostate cancer cells actually manufacture less PSA than do healthy and or benign prostate cells. And that leads us to the question, well, if prostate cells produce less PSA, then why do we draw the PSA? That's because prostate cells that are cancerous, they lack a basement membrane. In other words, they manufacture less PSA, but they don't have a basement membrane that restricts PSA from being leaked to the bloodstream. So therefore, even though they're producing less PSA, it's still going into the bloodstream. And hence that's why we test, because we don't know whether or not the PSA in your bloodstream or the PSA that is rising on the lab value, we don't know whether or not that's coming from healthy prostate tissue versus actually just being leaked beneath unhealthy cancerous prostate tissue. So let's say you do get your PSA values drawn and they're abnormal. Now what? First and foremost, don't freak out. A lot of times people will get the test drawn. It may be elevated, maybe slightly higher than it had previously been, and they'll freak out. But I always tell folks, don't freak out. Take a deep breath. Here's what we're going to do. We're going to retake it again here in a few weeks and make sure it's not just an isolated outlier. Now, if we take it again in a few weeks and it's still elevated as compared to your previous baseline, and when I say elevated, I say that with nuance because some people can be cruising at 2 or 3, and that might be high for you, but it may be low for them. So again, everything is taken with nuance and taken with clinical recognition of the patient. So yes, don't freak out. We'll check it again in a few weeks and we'll make sure we employ some good procedures prior to getting the blood work done, such as abstaining from sex or avoiding any kind of trauma to the area to ensure that we get an accurate reading. Some physicians, some prescribers, some literature suggests that you should empirically treat the patient with antibiotics just for 4 to 6 weeks to rule out any kind of underlying infection and or inflammation. And other prescribers elect not to because they just kind of want to see what your natural, raw, true baseline is. Anyway, thanks for watching today. In the next installment of this PSA series, we'll talk about things that can falsely elevate and things that can falsely lower your PSA values. Thanks.